It's important for us to recognize Eating Disorder Awareness Day, especially in our GI practice. 24% of the patients that we see in our GI practice are suffering from an eating disorder. It's important for us to be aware of symptoms that present in these patients, especially because they share commonalities with many other disorders that we see. It's also important that we address these patients because they really need multi-disciplinary approach in their care, involving not only their primary care doctor, their GI practitioners, getting a nutritionist involved, also GI psychologist or other mental health workers to provide the support that they need. Eating disorders are really a serious and at times can be life-threatening disorder that we need to recognize signs and symptoms, because a lot of times as the GI care providers, we are the first person to recognize what is going on with the patient. A lot of them present just as things that we would see every day, like reflux, esophagitis, constipation, changes in bowel habits, patients who are malnutrition, patients who are underweight. However, I do think that that's something that we need to be cautious about. You expect that patients are going to be very thin or look, in female, and that's certainly not true. And over these past couple of years, especially as mental illness has become more the forefront in medical care in general, it doesn't always look the way we expect it to. So in patients, for instance, patients with anorexia, that's a disorder where their caloric intake is severely restricted out of fear of gaining weight or fear of being overweight. So with that, we see that almost with that malnutrition and the electrolyte imbalance, patients' GI systems really can slow down to the point the stomach and the whole digestive system isn't doing its job anymore. So you end up with difficulty digesting your food, bloating, nausea, vomiting, difficulties with constipation, with diarrhea, and something like gastroparesis. Start having conversations about their relationship to their body, about their relationship to food, about how food makes them feel, about how they feel about their weight. Is there any restrictive behavior? Is there any purging behavior, binging behavior? Just really recognizing these patterns or begin to notice them. And when you do notice them, ask questions. Ask the individual how they feel, that if their foods are impacting their life, just asking about their GI symptoms, abdominal pain, nausea, vomiting, reflux.